It's a privilege. Yes, this is my assistant manager. It's a privilege and honor to be here to talk to you about one of my favorite subjects, or one of the things I'm really passionate about. And I thank Barbara and Giselle for the invitation.
Lena.
Lena. Oh. Okay, Lena.
Sounds
Sorry.
nice too.
I'm a physiotherapist, a registered physiotherapist and certified acupuncturist. I've been practicing acupuncture for over 20 years. And I'd like to share with you how this type of, we call it a modality, is how acupuncture works, and some of the different ways people practice acupuncture. There's quite a few ways. Acupuncture is used primarily to promote a stronger healing response from your body. So instead of taking several weeks, several months, maybe even a year to get better, acupuncture will speed the healing process up and hopefully get you back to where you want to be in a matter of weeks. But the longer you've had a problem, the lot more sessions it takes usually. I'd rather have somebody who's got really severe back pain that can hardly walk, but it's been there only a week. I can get lots better results, less treatments than somebody who's had this back pain that's sort of nuisance, nagging type pain that's been there for months, maybe a year, and then I know I've got a bit of a challenge and it's going to take quite a few sessions. How does acupuncture work? It involves putting, I was going to say sticking, I would say putting fine needles into the tissues of your body. And while the needle's sitting there for 15, 20 minutes, sometimes up to 30 minutes, it's stimulating nerves that send messages to your central nervous system, that your brain and spinal cord primarily. And these structures release endorphins, special substances that help decrease inflammation and muscle spasms, which are the two main reasons for pain. But also, it can help balance your biochemical hormonal system as well. So it can also be used so it can have a systemic effect. And some people, after they've had an acupuncture treatment, have come back to me and said, I couldn't believe how long I slept after the treatment, 10, 12 hours, it was great. By reducing pain, you also help people sleep better, they feel more relaxed, they have increased energy levels. A couple of reasons for slower healing responses: as we get older, our healing responses slow down. So a problem like a sprained ankle in your 20s and 30s that maybe didn't require any intervention at all, in your 60s and 70s requires some kind of intervention to get, depending on the degree of sprain, but an equally severe sprain. So that's one thing to take into account. Also, I believe that the more physically fit you are, the stronger your healing response is. Let's see. And you don't need to create pain when you do a treatment to get excellent results. Matter of fact, I usually try and not produce any pain at all. But that's easier said than done. One of the benefits of acupuncture is its minimal side effects. Unlike a lot of interventions Western medicine throws, especially medication, there's always some kind of side effect. In my 20 years of practice, I've inflicted maybe a small bruise where a needle site was, and occasionally had to deal with somebody fainting on me, usually during the first or second treatment because they're apprehensive about what's going to happen. But I've had people faint on me and I didn't even go near them with the needle. I was just doing some manual therapy and, wow, okay. Anyway, also you can sometimes have increased pain after an acupuncture treatment. And this is usually happens again with the first or second treatment. And the increased pain is for maybe 24 hours or less. And it's usually a good response because after 24 hours your pain settles down and you feel a lot better. And we generally refer to this as an over response, and in the long run a great response. Now with that said, it does help to know your anatomy. You do want to avoid some important structures like major arteries and the lung. So, and physiotherapists are really probably the most, health practitioner with the greatest expertise in anatomy. So now I'd like to get on with some of the approaches that people use. The first approach is, and the oldest, is called classical or acupuncture, TCM, traditional Chinese medicine, and of course has been around for thousands of years, started in China. And generally it's a good TCM treatment. It involves an assessment that looks at energy levels, yin and yang energy flowing through the 12 meridians of your body. And the practitioner usually comes up with a diagnosis that's out of this, makes no sense at all. It's like a shoe syndrome with liver heat rising kind of thing. Makes no sense, but it tells them where there's stagnation and how they do their treatment to get a response. So this type of approach is great for urinary problems, menstrual, reproductive disorders, respiratory disorders like asthma and bronchitis, also digestive disorders such as gastritis, constipation, diarrhea. It's the approach that not a lot of there's a few physiotherapists who are trained in this, but generally you probably want to seek out a traditional Chinese medicine, Oriental, more than likely Oriental, but I think there's a school in Toronto that teaches traditional Chinese medicine now. The next approach is called anatomical acupuncture, and that's probably the most common approach because it's used by all physiotherapists. And what it involves is Western medical understanding of anatomy, physiology, pathology, and what changes is not the acupuncture points, but the selection of the acupuncture points. So it's great for musculoskeletal problems and neurological problems, which is the expertise of most physiotherapists. It was actually developed in the 1980s here in Canada by a Canadian physician who was working in the area of physical rehabilitation. And they started teaching to other physicians, and then they started teaching it to physiotherapists. And I, to some extent, it's the physiotherapist's ability to make it work really well that started acupuncture's popularity. Some of the things that acupuncture can be treated for is neck pain, back pain, headaches, migraines, neuralgia, any kind of tendinitis, a frozen shoulder even, arthritic joints, even the jaw joint. Okay, the third type of acupuncture I'd like to talk about is even more recent onset. It's called IMS, or intermuscular stimulation, and it is predominantly practiced by physiotherapists. And it involves using an acupuncture needle to release tight muscles. For some unknown reason, and generally the longer you've had a pain, the more likely you're going to end up with muscles contracting and becoming tight and developing something called a trigger point, which is a tight, taut, rotary band inside the muscle. And trained practitioners can feel these trigger points and treat them with an acupuncture needle. Again, this approach was started here in Canada by another physician who was practicing in the area of physical rehabilitation. So say something like hip bursitis can frequently be caused by tight muscles in the buttock area. But why are those muscles become tight is usually the result of some abnormal nerve stimulation in the back. So a well-trained physiotherapist will recognize that, you know, it's not just a bursitis problem and go beyond that. And if you don't, and a good physiotherapist who realize that if you don't treat the back, you won't get lasting results. And sometimes that's why you go to a physician. Oh, you got bursitis, I'll give you a cortisone injection. You put the cortisone injection into the bursa, and it does nothing, because there's these underlying pathologies like these tight buttock muscles. And sometimes to get to these trigger points, certainly in the buttock area, they can be pretty deep, and you need sometimes to use some long needles, like 5 inches. So, it's not the most well tolerated, because you put the needle in, and then you have to do a kind of sewing machine type action with the needle. To release the trigger point, you take it out, you find another trigger point, you put the needle in, sewing machine action, release that trigger point, and then you move on until the client says, oh, it's enough. So this is where I kind of try other things, shall we say, first, before I try and resort to something like that. And this so this is one of the things I resort to, a recent equipment purchase. And what it does is, what you do is you put some lotion around this, and you put it on the skin, and you create a suction, and then you pull up, and you release all the subcutaneous tissue, and then you move the muscle, stretching while you're bringing this up. So it's a type of myofascial release, which is a manual therapy technique that a lot of practitioners, physiotherapists, massage therapists practice. So it's a new spin on that. So I'll resort to that first, and then if things aren't working out, I'll reach for the 5-inch needle if they want me to. But there's, I tell you, I've practiced it a bit, and most clients don't tolerate it all that much. It's so sometimes also what I use is I take 2 needles, put it into the trigger point, and hook it up to an electric current. And also, I use electric current a lot. It just provokes a little stronger response than the needle itself. Anyway, the last treatment approach is my favorite. I've only been practicing a couple years, but it's my favorite because of the incredible results I've been getting with it, and it's called ear acupuncture. And it sounds pretty weird, but there's some reasons why this works really well. It's funny, but the brain actually likes to make maps of its body in different parts of your body. So it'll make a map, it's made a map of your body in the sole of your foot. So there are practitioners out there called reflexologists who treat health problems strictly or solely with the foot. And there's also a map of your body in your hand. And there are acupuncturists who only needle the hand. And these people are called Korean hand acupuncturists. There's also a map of your body in your nose, a map of your body in your tongue, and believe it or not, there's this textbook here on tongue acupuncture. Not my taste either. But it's interesting because on the ear, it's very precise. If you have a pain in your little toe, I can needle that pain on your ear. And that's how precise it can be. Interesting, in both tongue acupuncture and ear acupuncture, they represent the structure by an inverted fetus. So on the tongue, you have this is the underlying part of the tongue. So the tip of the tongue represents the feet and the buttock area. And ear acupuncture, you have pretty much the same thing. There's your ear and the fetus upside down, so the earlobe represents the head of the body, the fetus, and up here is where the feet are, and this is where I need a barb for feet problems.
And it works.
Now, one of the ways this can be really, one of the reasons that make this approach is more effective than others is, well, before I get to that, ear acupuncture was actually developed in France, not China, and it was developed in the 50s by a neurologist who had training in acupuncture. And interesting, he had some clients from Africa that had these scars on their ears, and he inquired why they had these scars on their ears, and they all said that their back pain was cured by the tribal medicine man by putting a scar on their ear. I don't know how they do that, but anyway. So he started looking into this, and the first acupuncture point on the ear was for back pain. And that was in the 50s. In the 60s, he stumbled on something else, a skin reflex that we now call the vascular autonomic signal. And it's can be provoked even just by bringing the cell phone up. It's a very subtle response. It's a change in your blood volume, not your pulse rate. But it's palpated at the same spot on your wrist. And I can use some simple tools like this. This is we call a 3-volt hammer, positive on one side, negative on the other side. And on the ear, you have active points, but the only active points are there if there's an underlying pathology. So if you're perfectly healthy, which most people are not, but if you're perfectly healthy, you would have no active points on your ear. By scanning the ear with, say, this instrument, it'll provoke an active point that's felt through the skin reflex. So what's kind of neat is, because of this, I can figure out some underlying pathology that there's no other way of doing that. And you don't even need to get undressed. I don't even need your cooperation. Sometimes I have people falling asleep on me during the assessment, and through my special tools, their ear is whispering little secrets about their underlying pathology. It's quite interesting. Another thing that's neat about this approach is something called blockages to healing. And this is usually you get a blockage to healing through a fracture or a scar, and it doesn't matter how small the scar is or where in your body it is. And not all scars do that, most do not, but some scars, for again unknown reasons, cause this blockage to healing. And you can release that blockage to healing by needling it. Now you can do it on the scar itself, but it's a little trickier. If you've got a long scar, it can be anywhere in that scar, but on the ear, through the skin reflex, you can zero in on that blockage to healing and needle it very precisely. And actually, there's a whole system that tells you also how severe the blockage to healing is. I'm not going to get into all that, but so there's some of the ways that make ear acupuncture work more effectively than a lot of other approaches. Okay, I think I'd like to just kind of wrap up with some of my success stories with ear acupuncture. One of them was a lady I'd been treating for a couple of years with long-standing chronic fibromyalgia and arthritic pain, and she was on all kinds of medications. And I used to treat her once, twice a week just to try and keep her in some semblance of minimal pain, you know, comfort level, shall we say. Then I started practicing with ear acupuncture, and she was one of my first clients. And now I maybe treat her once every 3 weeks. And she has done so much better. She is completely off her morphine medication. She hardly touches her OxyContin. Her energy levels are higher. She's more active. She sleeps better. She used to only get a couple hours sleep a night. Now she gets 6, 7, sometimes a full night's sleep. So she's really pleased, and so am I. Another case success story was another woman, decades of neck pain, back pain, low back pain, mid back pain. But funny, when her major, most disconcerting symptom was not pain. It was when her back got really bad, it would cause her to belch, sometimes for hours on end. And she tried massage, she tried chiro, she tried physio, she would go to the gym and exercise and never get completely prolonged, lasting results until she tried the ear acupuncture. Now she's telling me that she hasn't felt this good since her firstborn, who turned 29 this year. So she's quite pleased. A final case story is an elderly gentleman that came to me with shingles pain in his leg, and it was so severe he had been hospitalized several times. They had put him on very high doses of medication. He thought high enough that it could treat a horse. Didn't touch his pain whatsoever. So after 2 months, he came to see me, and 8 treatments later, I discharged him with almost no pain. Occasionally shooting pain in his thigh for 30 seconds, maybe 3 or 4 times a day, that's it. This fellow was interesting because during the assessment I asked him about blockages healing, any scars, fractures. No, nothing. So I get into my assessment, and lo and behold, I find out he's got a really severe blockage to healing. So I said, okay, well, let's track this down. And on his ear, it was over his left elbow. So I asked him, did you ever injure your left elbow? And after a little pause, he says, yeah, when I was 21, I fell and broke it. And that was, for him, he had completely forgotten it because that was a half a century ago. But his ear did not lie. I knew it was there, and his ear revealed the underlying pathology. So in a nutshell, I'd like to thank you for lending me your ears. And if you have any questions, be pleased to answer them.
The gentleman working here has severe knee bone, and I wanted him to come.